Good morning, good afternoon, good evening, wherever you are. Welcome to yet another Dr. Akolo and NCLEX 101. Today we are going to discuss a very important topic, that is implanted venous access port, access, deaccess, and dressing change. So preparation for that, everyone in room should wear a mask, including the patient. Have the patient turn their head away if they are unable to tolerate a mask. Everyone assisting the procedure or within 3 feet of the sterile field should wear a head covering. Palpate the port and assess the site for symptoms of complication. If the port is already accessed, assess for blood return and flush the non-coring needle with sterile saline prior to the access and re-access. Consider topical pain management for access procedure. Implanted port dressings and anchoring needles need to be changed at the same time. Contact the vascular access team for loose dressing before a needle change is due. Daily CHD bathing treatments are required. That's for patients without CHD allergy, even if the port is not accessed. Setting up and removing the old dressing and needle. So what you do first is gather supplies and secure a clean workspace and perform hand hygiene. Open the dressing change kit and add appropriate size, length, non-coring needle and sterile saline syringe to the sterile field. Then don head covering and mask, don the PPEs as indicated, perform hand hygiene and don clean gloves. Attach the needles, connector and prime non-coring needle and extension with sterile saline. Attach empty 10 ml syringe to the extension set. Remove the old dressing from the bottom working towards the insertion site. Remove non-coring needle, then remove clean gloves and perform hand hygiene. Let's look at placement of non-coring needle and dressing. So don sterile gloves, lightly scrub the insertion site using a back and forth motion with a CHG for 30 seconds. Allow the site to dry at least 1 minute. Insert non-coring needle at 90 degrees until it hits the back of the port. Aspirate for blood return into the empty syringe and discard 3 ml. Flush with 10 ml sterile saline. Secure non-coring needle with sterile tape strip. For ports that will remain accessed for longer than 48 hours, apply CHG gel pad at the junction of the needle and the skin before applying the transparent dressing. Gauze dressing may be used for patients with skin sensitivities or requiring frequent dressing changes. Change sterile gauze every 48 hours and PRN when dressing becomes loose, damp, or soiled. Remove gloves and perform hand hygiene. Perform hand hygiene, don gloves, that's needless connector change. Perform hand hygiene, don gloves and PP and other PPE as needed. Mask requiring for any connector change. Flush new needleless neutral connector with saline. Keep saline syringe attached to the connector. Cleanse the junction of the needleless neutral connector and extension set or catheter hub with alcohol before removing connector. When you want to remove old connector, apply new needless neutral connector, flush to confirm patency, and then repeat for each chamber. Why the steps for preparation? Wearing mask. Why do we need to wear the mask? Because masking prevents contamination of the insertion site with respiratory contaminants. Wearing head covering hair prevents contamination of insertion sites with microbes that are prevalent in our hair. Hair is constantly being shed. Palpating the port, assessing the site tenderness or warmth could signal an infection that would preclude device access. Access ports, accessing for blood return, flushing the non-coring needle patency and proper position of the needle can only be ensured when blood return is present. Considering topical pain management can assist with needle phobia and improve patient satisfactory. Changing at the same time implanted port dressing and non-coring needles. Once the skin is cleansed and the dressing is applied, normal flora on the skin begin to regrow. It is impossible to clean under an existing port needle. Daily CHG bathing treatments. CHG bathing has been shown to reduce the microbial burden on the skin. If the port needs to be accessed during the patient's stay, the number of microbes on the skin will be lower. Removing and dressing, gather supplies, secure clean workspace. Why do we do this? Because contamination risk is low when all components of a task are readily available and placed on a clean, dry surface. Why do we perform hand hygiene? To reduce microbes on the skin. Attach empty 10 ml syringe to the extension set. Why do we do that? The empty 10 ml syringe is used to aspirate blood when accessing the port. Why do we remove the old dressing from the bottom working towards the insertion site? To prevent inadvertent needle dislodgement. Why do we remove clean gloves? Perform hand hygiene. That's after touching the skin and old needle, the gloves are contaminated. Why do we do CHG scrub for 30 seconds? Because CHG penetrates several layers of the skin when light friction is used. Why do we allow the site to dry at least 1 minute? Failure to allow the skin cleanser to dry is a source of skin breakdown and chemical burning. Why do we insert non-coring needle at 90 degrees to ensure stable placement? Why do we aspirate for blood return discard? 3 ml aspiration blood verifies patency and functionality of the port. The aspirated blood is discarded. Any small piece of the septum that could go with the needle insertion will be aspirated and discarded. Why do we flush with 10 ml sterile saline? To clear the lumen of blood and prevent occlusion. Why do we secure the non-coring needle? To prevent needle pistoning and dislodgement. Why do we do port access above 48 hours and apply CHG gel pad? CHG effects are persistent for 48 hours. CHG reduces bio burden on the skin for up to 48 hours, and the CHG gel is only necessary after the time frame. For gauze dressing, change every 48 hours, and parent gauze dressings are more prone to moisture accumulation and bacterial growth if left longer than 48 hours. Needle connector change. Mask required any open lumen is at risk for aerosolized respiratory contaminants. Why do we flush new needles? Needless neutral connector to remove any air in the device and ensure functionality. Why do we clean junction and extension set or catheter hub before removing connector? Thus, cleaning the connection prevents inadvertent contamination of the lumen as the old connector is removed. Opened lumen should not be cleansed due to risk for contamination and breakdown of the plastic caused by solvents.